Good evening to everyone and welcome to today's session. COMED is one of the interesting exams because of the composition of some originally framed questions, few case study based questions. So every year it's our tradition to discuss this historical paper. We welcome our online students from Tirupati, Vijayawada, Guntur, Naina, Mamta, Sara and everybody. How many of you have taken the actual COMED doctor among you? Oh, very good. Please give mic to the doctors for them to express their opinion. Now what is the analysis of COMED 2014? We call category A just like dots, TB treatment. Questions unknown to many, questions whose answers are unknown to many, and where your luck, astrology is more important. 25 such questions are there in 180 paper. Then we have category T, questions that require a conceptual clarity and a good guessing skills. Forget about kissing skills. So, that guessing talent if you have, 35 questions are dependent on that. Then, any serious MD entrance aspirant surely can answer very easily around 120 questions. So, what is the topper score is a golden question asked by many students. It is the third score, 120, which is most students supposed to answer. Cakewalk. If you are a serious student prepared for MD entrance, 120, 50% at least on those luck dependent questions of category A, and 70% of those where your talent is required out of 35. If you combine all, 120 plus 18 plus 15 plus 25, it is 160 to 165 out of 180 is going to be the top rank. That is the prediction. And 10 marks below that is the point till which you will get the good, decent rank. So if you got 150, be very happy. You are sure to join through the exam. So that is the short analysis, doctor. Now let's make the start. Surgically used suture material polydioxanone. In surgery high yield topic list which we have given to you, suture material is one of the favorite topic, doctor, in the top 50 important topics. So basically you need to know the classification, absorbable, non-absorbable sutures. So polydioxanone is degraded by hydrolysis. It is completely reabsorbed in about 6 months and can be seen only a minimal foreign body reaction. That is the speciality of polydioxanone is what need to be basically remembered. It undergoes hydrolysis and complete absorption is going to be a true statement. Which category question does it belong to? I don't think ordinary students will crack it straight away. But it comes under the talent based 35 questions. You agree with my classification? If you disagree, let me know. What is the most common cause of abortion? Can the online students can punch whether the voice is loud and clear? Kakinada, Guntur, Tirupati, Vijayawada, Vizag, Naina and everybody. Is the voice loud and clear for you? I hope so. Now, what is the most common cause of abortion? Silliest question in the world. Chromosomal anomalies are the cause. That's the reason a defective embryo. Crackles, where do you listen? If you have gone to general medicine posting at least for 2 weeks also, you can answer this. That whenever there is a bronchial pathology, crepitations and crackles are considered to be the hallmark of the bronchiolitis is what you need to basically remember. Subepidermal bliss with IgA deposition. What are the top 20 high yield topics? How many of you didn't receive that high yield topic list book? You didn't know? Please give to the doctors high yield topic 1197 topic book list. Around 120 questions are straight from what we predicted out of 180. The remaining questions may around 50% also from predicted topics only. But the problem is they are little hi-fi questions. So what is your answer, doctor? Dermatitis herpetiformis. What is the drug that you will use to treat it? Doctor, give an answer into the mic. What drug for dermatitis herpetiformis comes to your mind? It is also used in leprosy. Dapsone. Beautiful. Now, doctor, uncontrollable tendency to fall asleep in inappropriate time, say narcolepsy. Generally, narcolepsy's treatment we know. What drugs cause narcolepsy? Oh, you require talent. Not even talent, you require luck. So, pramipexole, that's the reason I classified it as A1, category A mein first question. Earlier suture material question is a talent based question. Agar padhe to answer kar sakte. Ye to blind guess. So, pramipexole is basically a dopamine agonist of non-ergogenic class, and it is used for treating the Parkinson's disease and restless leg syndrome. Of course, if you go to the high yield topic list, pharmacology mein Parkinson's drugs is one of the top 30 topics, and Parkinsonism as a topic is high yield topic in general medicine. Definitely one question will come on that. But this is very, very untimely question about pramipexole's tendency to lead to development of narcolepsy is what you need to basically remember. That's right. I am very happy to see our online students Mamata, Asha, Sara, everybody actively answering the questions. That's the whole spirit, doctor. Now, lateral dural wall of cavernous sinus, which is not involved. Very standard question. Cavernous sinus anatomy ke bina, it is like watching Sholay without Gabbar Singh. Definitely there will be a question on cavernous sinus, very high yield topic. It is a common topic for anatomy, for ENT, for so many areas. So there is a reason, doctor. Abducens. You remember this important dictum. Oculomotor nerve, trochlear, ophthalmic division of trigeminal, maxillary division of trigeminal. They are all the things which are there along the lateral wall. But abducens does not run in the lateral wall. Rather, it runs in the middle of the sinus, and it runs along the side of the internal carotid artery. That is all about the cavernous sinus. Fibrillin 1, Marfan syndrome. ये कोई क्वेश्चन है क्या? Anybody will answer it. Thyroid sign is seen in. Oh, doctor. Sexual perversions is the favorite topic in the forensic medicine for the examiner. But this is the worst perversion that you can, perversion based question. Thyroid sign. It purely requires luck. Right? A based question, A category question. Anal abuse, doctor, typically thickened anal folds with venous congestion. As what you can see here, thickened anal folds is a typical feature which is called as Thyroid sign. Superior oblique muscle. Whenever you go to entrance, you must be looking forward. Where is that extraocular muscle question? उत्ता स्टैंडर्ड क्वेश्चन है ये, इसमें भी लोगों को डाउट आ रहे. If you go online, lot of our students say, sir, is it adducted or abducted? हो सकता क्या? एग्जामिनर का की रॉन्ग है, एग्जामिनर का की बिल्कुल रॉन्ग नहीं है. There are 2 questions in the entire key which was wrong by the examiner. Maybe they might have observed it by now. I'll come to those questions. So superior oblique, what will it do, doctor? When the eye get adducted, it depresses it. If you look at your nose, your eye need to adduct and depress, for which you require superior oblique. Superior oblique. So its main action is intorsion. Secondary action is depression, especially in the adducted position, and the tertiary action is abduction. Tertiary action is abduction. So it is remembered as solid. Superior oblique is LID. So that's what you need to basically remember. Anemia according to the WHO. How do you like to define it, doctor? Very, very standard question. It is basically 11 grams per liter. Very expected question fundamentally. Now, doctor, comes a luck based question. You have taken COMED exam? No. So, luck based question. Try your luck. What is your possible answer? Those who took COMED, please shoot your original answer. Our audience want to listen your cute voice, doctor. Please.
Calterol.
Huh?
Calterol. C.
Calterol. You tried luck on the horse called Calterol horse. Let us see what our online students say. Asha tried her luck on albuterol, because that is the only drug that she know among the beta 2 agonistic drugs. Very good. Mamta, Rukesh and Sara thought it as prenalterol. See, luck means what that happens to few people is called luck. What that happens to few people is also called catastrophe. Only these 2 things occur very rarely to the people. Clenbuterol. Don't worry if you answered this wrong. This is our third question, which is luck based question. Okay, doctor? A3. Clenbuterol is a sympathomimetic amine generally used for the sufferers of the breathing disorders. Just like any other beta 2 agonist is a bronchodilator. But in 2013, Mexican boxer Eric Morales, among many other players earlier, he was suspended when he was found positive for clenbuterol. There are people whose titles were snatched back retrogradely when they detected clenbuterol, because it is used as a performance improving drug, is what you have to basically remember, doctor. Now, drug antibody reaction leading to thrombocytopenia. Who would like to possibly answer? Yes, doctor. Your name, doctor? Sana? Very good. Sana, आपका original answer बोलो बेटे. What do you think? A guess मारो. Question number 12. Question number 12. Even online students keep punching your answers. They would like to. That's good. Sara thinks quinine. Classical. Quinine, quinidine. Autoimmune hemolytic anemia means that chapter mein pathology, general medicine mein we talk only about quinine induced hemolysis. You are supposed to, it is one among the 120 questions, let me tell you. I told no 120 to आम आदमी answer कर सकते out of this 180 questions. 35 those who are lucky, 25 who are good in 25 lucky, 35 who are good in guessing. That's the deal, right? Let us see. Bone infarcts. Where do you see, doctor? Very standard question. You have a typical vaso-occlusive crisis in sickle cell disease that lead to development of bone infarcts. Parafollicular cells in the thyroid. From where are they derived, doctor? What is the high yield topic in anatomy? Neural crest derivatives. एक्टोडर्म, एंडोडर्म, मेसोडर्म derivatives and neural crest derivatives के बिना पेपर नहीं होगा. There are 2 questions on neural crest derivatives in the same paper. You have to read, doctor. Once more, when you go to the state MD entrance, paper will be like this only. 120 out of 180 means कितना percentage है? 2/3. 2/3 of the paper is Aam Aadmi paper. Any person who prepared for entrance simply, no coaching, no drama. If you prepared well, you will answer. Remaining questions based on 50% on luck and 50% on good guessing skills. But this 2/3 questions, if you do wrong, you will be going behind and behind the competition. That's the whole secret. And COMED K paper is the classical textbook formula based cricket. Classically, the same distribution. Okay, doctor. So it is a neural crest derivative. Parafollicular C cells. So you must know what are the mesectodermal endocrinal cells which are derived from neural crest. Even iris pigment cells, melanocytes, everything, they are all derived. I leave to you the literature of explanatory booklet. He gave? Answer was given as ultimobranchial. Oh, I see. Yeah, I mean, we need to know the neural crest derivatives basically. That's the idea. IgA deposition in the mesangium. Where do you find? Classical question. Very standard question. Henoch-Conlin's purpura. Typically, patient is having respiratory tract infection. See, what is called spectrum of disease? IgA nephropathy on one side, Henoch-Conlin purpura on other side are considered to be the same spectrum. IgA nephropathy में kidney का involvement होता है. And Henoch-Conlin purpura में skin and other parts, vasculitic involvement is there. But they are considered to be the same part of the spectrum of disease, is what you have to basically remember. Horner's में cheapest question in the planet. Meiosis or mydriasis? What will you have? Meiosis. Normally sympathetic will dilate, sympathoplasia causes constriction. You don't find any Marcus gun pupil. That's what you need to remember. Now comes a talent based question. Widest transverse diameter of fetal skull. If you go to obstetrics gynecology, doctor, fetal skull is one of the high yield topics in the topic list. Please give to the doctors. Did you receive topic list? 1197 topic list booklet. Please give to both the doctors. Why it is called talent based question? Forgetting all parties. The guy who sat in the reading room, remembering every skull diameter like a tailor going to stitch a shirt for the skull of the fetus. If you prepare sincerely, you can answer this, and answering this is rewarding. This kind of question once more will come in the tomorrow's exam. Occipito-frontal 11.5 duct, biparietal 9.5, bitemporal 8, occipito-mental 12.5, suboccipito-bregmatic is 9.5. All these diameters you must know. The wrong answer given in the key was biparietal. The correct answer that need to be remembered is occipito-frontal, because the biparietal is how much? Out of all these, 9.5 only. But the occipito-frontal is how much? Occipito-frontal 11.5. So that is the wider diameter. Occipito-frontal is not, oh, that is the point here. Good. Examiner is intelligent. That means he is not wrong. So it should not be widest transverse being given, yeah, then examiner is correct. That biparietal should be the answer then. Because bitemporal also is transverse. But bitemporal is 8 only, no? So that makes biparietal become the correct answer. Very good correction. I thought there is a correction. Very good. Mamta Rukesh also agrees with you, saying it is the transverse which is being asked. That's a good point. Very good. So we will, correct answer is only given in the key. Good. Now, which prosthesis doesn't have cement? Lakh based question. Purely. The only process that you have heard after being born and gone to orthopedics posting like a formality for 1 week, 10 days. What process did you listen? Austin Moore's process. Basically, we have Thomson and Austin Moore process are the routine options. Austin Moore is usually inserted without cement, Thomson is with cement. So this is a typical Austin Moore process which doesn't have cement. Oh doctor, do you like to call this as talent based or luck based? Purely luck based. Glaucoma, mein lot of beautiful questions are there. Glaucoma, drugs, so many things. But examiner want to know how much you have seen into the fundus of the patient. How do you want to interpret the size of the optic disc? Normally only some people can have a larger disc. So whenever there is an asymmetry in cup disc ratio of 0.2, you call it as a significant glaucoma. So I leave to you the literature. What is the different story? For example, in this healthy patient's eyes, you are seeing asymmetry in their disc cup ratio. This is physiological but not pathological. One is 0.65, other is 0.35. C by D ratios. But how much more is, what is the difference between the two? 0.3, no? 0.3 means anything more than 0.2 is considered to be glaucomatous. Then it is no more physiological. It should be then pathological. Now doctor, peritoneal dissemination of gastric cancer. Very easy, because it is once more a guessing based question, honestly speaking. Laparoscopy nowadays, you can do anything with laparoscopy by peeping into the interiors of the abdomen. So that is the reason peritoneal mets can very well be made out by checking through laparoscopy. Pregnancy, commonest cause of chest pain. If I am asked, my first conclusion will be reflux in pregnancy. But here musculoskeletal pain being there, musculoskeletal pain is more likely to be an. What is your popular answer? You thought angina pectoris? No. You thought gastritis? Reflux. I too thought acid peptic ulcer disease, but when I checked, to my surprise, I discovered musculoskeletal is much more common than peptic ulcer disease. Now doctor, isometric exercise may, what are the cardiovascular changes? Talent based question. You must be that guy who read Genong's Physiology left and right in your MBBS days. But let me remember, exercise associated physiology. If you look at the top 60 topics, it is top 20 or 23rd topic in the high yield topic list, which is routinely asked in the previous exams. So doctor, stroke volume is not altered. So what happens with the isometric exercise? There is an increase in the mean heart rate. There is a increase in the systolic and diastolic and mean BP. But stroke volume remains constant, is the point that you need to appreciate. And similarly, systemic vascular resistance also will not alter much with isometric exercise. So what is the, every mock test on Sunday, what is our cry about? Read leukemias, 4 leukemias, CLL, CML, ALL, AML, and lymphomas, and don't forget and ignore CD markers, especially hairy cell leukemia and everything. One question on CDs, अगर नहीं है तो वो Indian entrance नहीं होगा. So what is your answer, doctor? TDT, terminal deoxynucleotide transferase. It is found in immature, pre-B, pre-T, and ALL and lymphoma cells is what you have to basically appreciate. Arctus ulcers, skip lesions, anal sparing. One question on inflammatory bowel disease के बिना paper होगा क्या? नहीं होगा. So that table of differences between ulcerative colitis, Crohn's disease, पढ़ना जरूर है. Darling's disease is purely luck based question. Your darling may be waiting to see what rank Majnu will be getting ultimately. So why it's called darling disease? Okay, what is your guesswork, doctor, in the exam? Histo? Sure? Oh, your name, doc? Chakradhar's luck is working like a true Chakradhari. Histoplasmosis. But why it is called darling disease, do you know? No? That is called luck. So, it is also called cave disease. When you go tomorrow for Tamil Nadu State MD or Kerala State MD, you may get which disease is called cave disease. Ohio Valley disease, reticuloendotheliosis, Spelunker's disease. It's called Darling's disease because it was discovered by Samuel Darling. If Buchaya discovered, you call it as Buchayosis. So that is the problem. Now, what is the measure of dispersion? Very standard question. So basically, median is not a measure. Range, interquartile, mean difference, sample standard deviation, coefficient of variation, quartile coefficient, they are all the measures of dispersion. 60-year-old male, ischemic heart disease, atrial fibrillation typically develops an embolic episode. Acute arterial embolism is a classical answer. Very simple. इतना लंबा स्टोरी दिए तो आंसर फिर भी रॉन्ग करे तो then we are gone. Always remember, case study based questions easy to crack. Very easy to crack. Pray God that such questions will be more in the actual exam. Organ laser trabeculoplasty. Standard question. Open angle glaucoma. Suppose if you answered angle closure glaucoma and come home and cry, I thought, no, you did not think, you did not study the topic of glaucoma iska matlab. Okay, so this kind of questions you should not do wrong. 120, 2/3 of question paper is like this. Dugas clinical test, another very standard question. Typically the touch of opposite shoulder. If you go to the high yield topic list in orthopedics, top 10 topics में आपका shoulder dislocation रहेगा. अगर shoulder dislocation नहीं पढ़ के एग्जाम गए तो nobody will help. So Dugas clinical test is typically what you see. As per National Immunization Program, doctor, what diluent is used for diluting Japanese encephalitis vaccine? What will you do if you see similar kind of question in the exam hall? You studied everything about vaccines, what are live vaccines, what are attenuated vaccines, and you went to exam expecting a simple question like BCG. Suddenly examiner asks this question. Luck based question. Think that none of your classmates will answer unless they are lucky enough. Okay, doc? Phosphate buffer solution. Phosphate buffer is a one which is used to reconstitute. It is supplied by the same company which produces Japanese encephalitis vaccine. But what is the point I want to remind you? You go to SPM high yield topic list. Highest number of questions come basically from the top 3 topics where vaccines rehta. 4th topic is vaccines. So what is the carry home second highest vaccines? Yeah, पार्क ओपन करे तो वैक्सीन पहला पढ़ना बिफोर योर पेट्रोल इज ओवर. You have to see that you are done maximum with that subject. Seats. Preparing for a subject is like a honeymoon experience. As the honeymoon is ending, your disgust will increase and enthusiasm will slowly come down most of the times. So that honeymoon way of preparation is what you need on each subject. So when you open the textbook, when your energy is high, when the week has just started in your timetable for that subject, read the high yield topics. Vaccines you should read. Okay, doc. Laser iridotomy, simple question. This is angle closure. Glaucoma is what you need to basically remember. Now, transurethral resection mein, cheapest question. Anybody will answer who has a pinch of salt in the war of entrance. 1.5% glycine. What are the complications of having used the glycine? Hypertonic solutions. What dyslipidemias occur? These are all the favorite issues. Known issues about the transurethral resection. Erythromelalgia. First time some of you might have heard what is this condition. So, what question you like to put it as? It looks simple, but it is purely luck based, let me tell you. Lot of people thought gout or somebody thought diabetes. Okay, what is erythromelalgia? Those who suffer from erythromelalgia typically have this kind of episodes of paroxysmal distressing vasodilatation in the palms and the soles. Erythromelalgia. And it is basically can be secondary or it can be idiopathic. If it is secondary, it can be due to myeloproliferative disorders, it can be due to hypertension, venous insufficiency, SLE, diabetes, gout, multiple sclerosis, anything can lead to it. Where will you remember all those things, doctor? Purely luck, if you answered it correctly, right? So that is very important. If you answered it wrong, no issue. I don't know totally how many questions luck based. 25 questions luck based, no, usme dal do. Talent based 35 hai. How much you answered that using common sense? 35 questions. That is a important factor that will take you forward in the scoring. That 120 based questions, agar if you answered wrong, examiner will think you are a robot. You are too early for this exam and maybe you are better for the next exam is what examiner want to tell you. So doctor, membranous disruption of the prostate, prostatomembranous disruption. How do you want to manage? Which category question is this? Forget about knowledge, answer and all that. वो तो देख लेंगे. I want to give you a feeling as to what is the strategy. You must know entrance is not an equation of knowledge. You must know what is the experience you are going to face in tomorrow's next entrance, etc. If you know what is the ultimate real experience of the situation, your preparation will be much more interesting and you will tune it accordingly. This is a controversial issue in the urology itself. There are some people who said you try to do correction, definitive correction then and there. Some urologists, another school of thought is don't do that, put a suprapubic cystostomy and try to gain some time. It's a controversy in the urology itself. After all, you are MBBS students. So, doctor, the controversy that has a higher number of votes worldwide is suprapubic cystostomy for a prostatomembranous disruption whenever there is any pelvic trauma. So that is the answer. So what I like to call this as, this is purely question number 9, which is luck based, is what I want to tell you. Now, how do you give BCG vaccine? ये तो 120 वाला question है. 120 out of 180 मैं बोला ना, minimum guarantee questions करना. यहां भी आप इंट्रामस्कुलर और सबक्यूटेनियस आंसर करके आए तो बताओ, हम आपको फ्री कोचिंग दे देंगे. सो NRHM, नेशनल रूरल हेल्थ मिशन. सो जननी सुरक्षा योजना, आशा, accredited social health, all these topics, without that you can't escape. Preventive medicines, RAP. Simple. This most of the good students might have answered, right? 2005. Expressed breast milk can be stored how long? Breast milk, cow milk, uska constituents, breastfeeding, high yield topic in preventive medicine. Everything about milk, like a dairy farm owner, you must be 4 to 5, you thought, eh? No, doctor, 6 to 8. That is where all the guesswork is about. Breast milk can safely stand at room temperature for 6 to 8 hours and need not be discarded if the first feeding attempt is incomplete. That's a very, very important point. If you need explanatory booklets, he will provide you. In magnetic resonance imaging, paramagnetic substances, what will they do? One more luck based question. Highly luck based question. You know what will blood will do, what will water will do, what will pus will do, what will bone will be looking like. That's how you prepared for exam. ये बीच में आके पैरामैग्नेटिक क्या करता, डायमैग्नेटिक क्या करता, फिजिक्स बहुत दिन हो गया पढ़ के भूल जाके. So doctor, it will shorten both T1 and T2. Mainly any substance is considered to be dia or paramagnetic. And most substance consists of elements of electrons which are paired in the orbitals. So you must know what is meant by diamagnetic, what is meant by paramagnetic. I leave all that in the literature given to you. Just please review that. Okay, doctor? Now, critical limbic ischemia. How do you define it? This is a very standard question. इसमें कुछ confusion नहीं है. Why? What is the standard question in the surgery? Ankle brachial pressure less than 1, equal to 1, more than 1. When do you call critical ischemia? All these are the known issues for the entrance. So, the rest pain is considered to be critical limb ischemia. Non-healing wounds are critical limb ischemia. Gangrene is critical limb ischemia. That's how it is being clinically defined. Bovine cough, where do you see? Classical question. Now, in normal pregnancy, when will amniotic fluid will be maximum is an important question. What is your answer, doctor? Maximum amniotic fluid. Few people said 38 weeks, few said 36 weeks. They want to get the correct answer. My job is to give the Asha is proposing 36 weeks. Mamta Rukesh is proposing 36 weeks. I am very happy to see 25 online viewers and many more across the country. So, doctor, 36 weeks is the final judgment. It will reach a maximum of 1100 to 1500 milliliters at 36 weeks of gestation is what you need to basically remember. Now, in an act of tribadism, what is the active partner called as? Every time in exam, one question definitely comes on sexual perversions, definition of rape, etc. So, what is tribadism? It's basically a non-penetrative form of sex, more prevalent among lesbians, where the woman rubs her vulva against the partner's body, typically to the other partner's vulva up to her thighs, brings the sexual stimulation, which is called tribadism. So, What is tribadism? If it is asked, most of us would have answered correctly. ये बीच में active partner को क्या बोलेगा, passive partner को क्या बोलेगा बोले तो difficult. So basically we call the active partner butch, and femi is called as the one who is receiving that rubbing is basically called femi. So that's all about tribadism. The concentration of the dissolved gas in a solution. Suddenly in the exam hall you will remember your chemistry teacher who first taught you what is Henry's law. Esophageal adenocarcinoma classically is Barrett's esophagus. How long Treponema pallidum can survive in a ordinary refrigerator? I told no. पढ़ने के बाद भी Treponema will mislead you, or this kind of questions. Shall we call luck based? Absolutely luck based, doctor. 11th question which is luck based. It has nothing to do with your preparation. Close the eyes, pray the God and answer whatever comes to your mind. If you are born to do MD, you will get it. But ultimate rank is not decided by luck based questions. Whether the 2/3 questions like Stitadi Munivruhyati, stable mind without hilting anywhere, whether you answered correctly or not, is first deciding factor. Guess based questions, at least 70% you correctly answered or not is the second important factor. Last comes luck based questions. So this kind of questions don't worry. Iliac horns are seen in. This purely tests your elimination skills. Once more a luck based question. Who will know iliac horns and nail patella syndrome? Most wrongly guessed answer was mucopolysaccharidosis. What was your answer, Chakravar? Mucopolysaccharidosis, right? Lot of our students called and said we answered mucopolysaccharidosis, sir. Please check anywhere that iliac horns will be found in mucopolysaccharidosis. Pray the God. No, sir. They are there in the nail patella syndrome. In fact, nail patella syndrome is also known as Hood syndrome. So this is a typical AP radiograph which shows a bony exhaustosis thought to be radiologically pathognomonic of nail patella syndrome. Utna importance hai iliac horns ke bare mein. Okay. Now, this question is purely talent based. You must be a good student of physiology to answer this. Vital capacity, respiratory rate, tidal volume, dead space were given. So what is the formula? Tidal volume into breathing rate will give you minute ventilation. From that you need to subtract dead space ventilation. That gives you alveolar ventilation. In our case, tidal volume 500 into breath rate 14 minus the dead space 150 into breath rate 14 is dead space ventilation. So it is 500 minus 150, 350 into 14 is 4900 ml become the answer. Then what is the vital capacity doing here? Yeah, it has no role actually speaking. Okay. Now, non-small cell carcinoma mein, what is the unfavorable factor? I like to call this question very standard question. Many times it has been asked. Pulmonary osteoarthropathy can occur in a lot of benign conditions other than cancer. इसलिए अगर कैंसर में वो दिखाई दिए तो प्रोग्नोसिस के ऊपर उसका कुछ भी असर नहीं है. That is what you need to be quite sure about. So what factors will then decide the prognosis of small cell cancer? Pulmonary symptoms, size of the tumor, non-squamous histology, metastasis, vascular invasion. They are all the deciding factors. So what is the function of Golgi apparatus? Basic biology, 8th class question. It basically helps in maturation, not synthesis or segregation. I mean, not in sequencing or synthesis. In fact, there are some theories called as maturation hypothesis, big story about Golgi tendon organ, Golgi bodies. Sulfur containing vitamin kaun sa hai? Biochemistry mein, what is the highest number of questions asked doctor till now in the history of biochemistry? Biochemistry bole to hum unnecessary things we will read when we open Harper or any book. Vitamins. Entrance without vitamins is non-existent. Simple rule. इसलिए मैं क्या बोल रहा हूं, वो लिस्ट ले जाके अभी भी 1 महीना टाइम है. So in this 1 month में try to finish at least top 20 topics out of 60 topics I gave on each. Only top 20 you read and then go for exam. Still you will crack it, let me tell you. So doctor, thiamine has a thiazole moiety which contains, thio means sulfur. Immunoglobulins. Microbiology में higher topic list निकल बेटा. Microbiology में 3rd or 4th will be immunoglobulins. 5th immunoglobulins. I am telling you now, in that list given to you, top 20 पढ़ के जाओ. हमारे ऊपर मेहरबानी कर रहे आप. If you read top 20, still you will get the seat. Thoroughly if you read, the last 1 month mein. If you have 4 months time, read top 40 topics in each of the 60 topics in each subject. If you have 8 months time, read all 1197 topics and go to exam. That is the strategy. Okay. Immunoglobulins में immunoglobulin G को बोलते हैं opsonin. There is no confusion. What is the famous wrong answer, you know? In this, most of the people wrongly if they answered. Chakrader, what is the possible wrong answer? M, E. I heard some people saying E, so we need to check. Now, niacin induced flushing and pruritus. What is accept about it? Basically, one hypolipidemic drug जरूर आएगा बोल के every week in mock test I keep telling. Niacin, statins, gemfibrozil, everything you must read doctor. Niacin में flushing होना उनका nature है. अगर flushing हुए तो उसको बंद करने का कुछ भी recommendation नहीं है. Flushing होने के बावजूद इस्तेमाल करो उसको. That is what is the recommendation. So there is no recommendation to stop it. Fundamental issue. Niacin पढ़े तो बड़े alphabets में he will give in any pharmacology book, good pharmacology book, whether Lange, Katzeng or Satoskar or any book you read. Follicular carcinoma adenoma का बीच में फर्क क्या है? Capsular invasion. Even a LKG baby will answer this correctly. No big deal. Now, liver biopsy में pigments है, which are polymers of epinephrine. What is also called piggy liver is a typical appearance which you see in Dubin Johnson classically. Next entrance, state entrance लिखते ना, तब पूछते Dubin Johnson में pigment is because of which substance? What is your answer? Polymer of epinephrine is what you should answer it, doctor. Executive magistrate is appointed by. Do you think ordinary human beings can answer this? Maximum people will study about how much punishment each judge can give, how much money punishment, how much jail punishment, who appoints. Luck, pure luck. So doctor, I put 12th question which is based on luck factor. State government is having the power to decide executive magistrate. Okay doctor, I leave the literature for you to review. Parts puffy tumor is osteomyelitis of frontal lobe. Routine question. Small gastrinoma को detect करने के लिए endoscopic ultrasound has revolutionized the management. Now comes the next luck based question. कॉन्शियसनेस कितना टेम्परेचर आने के बाद डिप्रेस होगा हाइपोथर्मिया में? फर्स्ट ऑफ ऑल ऑफ अस आर प्रिपेयर्ड फॉर हाउ मच टेम्परेचर को हाइपोथर्मिया पूछेगा. नॉट व्हेन विल breath will stop, when will brain will stop, when will heart will stop, at what temperature? Luck factor, purely. 13th question, luck factor based. Actually speaking, below 30 degrees, depressed consciousness. Lowest figure available is 32. Chakradhar, you answered 32 only, no? No. Oh. इसलिए, if Chakradhar didn't answer means definitely luck factor based only. That's right. Now, doctor, diabetes, gallstones, steatorrhea. Very standard question. Somatostatinoma. Typically, it is 120, doctor, Aam Aadmi question this is. Anybody who prepared for exam, seriously, I will answer this. Picket fence type of fever with otalgia with ear discharge. So one of the complications, intracranial, extracranial complications of the suppurative radius media, one of the top high yield topics in ENT, lateral sinus thrombophlebitis, renal papillary necrosis, analgesic abuse, diabetes, sickle cell nephropathy, standard question in the exam. Ask him to get some biscuits. Now, local anesthetic with the vasodilation property. Lot of people wrongly answered lidocaine. Extra intelligent answer and otherwise a Aam Aadmi question. So what is your answer, doctor? Huh? You thought question was framed wrongly. Doctor, in our mock test you can do that. Think that. Examiner will not, in real exam don't think like that. Except? No. Prilocaine has a special property of causing vasodilation. Prilocaine has a special property of causing vasodilation. Levobupivacaine, ropivacaine, mepivacaine, lidocaine, they produce vasoconstriction both in vivo and also in vitro. To increase the vasoconstriction, we use adrenaline. By themselves, they are not vasodilators. Soiling index. How many thought it as water pollution? Oh, you thought like that? No, Chakradhar. Standard 120 आम आदमी क्वेश्चन है. अगर यहां भी हम खो गए तो कैसे डॉक्टर? That's right. Now you should not forget air pollution, doctor. Air pollution. Soiling index or coefficient of haze is what is considered to be an important indication. In Hyderabad आजकल सुबह बिल्डिंग के ऊपर अर्ली मॉर्निंग गए तो क्या दिखता? It looks like a fog in Nainital. Don't be happy that it is all beautiful fog. Nainital, शिमला जाने का जरूरत क्या है? हैदराबाद में बिल्डिंग के ऊपर गए तो हो गया. No doctor, it is smog. Smoke plus the fog. More dangerous. So we are all living and loving in the era of air pollution. So be very sure. In India, what is legal blindness defined as? Even a great examiner can give wrong key. 2 to 3 answers can go wrong. This is one such. He gave it as best corrected 3/60, but correct answer will be 6/60. 6/60 is the definition. Albright syndrome. What is it associated with? Precocious puberty, polyarthrotic dysplasia, and classically pseudo-hypoparathyroidism are all the associated features of the Albright's hereditary osteodystrophy is what need to be remembered. अब आ गया अपनी लक की परीक्षा. This kind of questions are generally framed before giving that 1 crore in कौन बनेगा करोड़पति. So, what is your answer? Very difficult to guess. HIV prevalence among adults is 0.27%. Otherwise, 2.7 per 1000. If you date with 1000 men, there is a chance of 3 men out of those 1000 guys to be possibly retroviral positive. A bone bruise or a contusion, how do you like to differentiate? This does not require any special gyan, purely guesswork. Right, doctor? So MRI, especially in the sports injuries, to know contusion versus bone bruise. Bone bruise accelerates the process of arthritis, is what you have to basically remember where we use the MRI. Which dermatophyte affects the skin and nails but not hair? Classical question in the exam. Right, doctor? If you go to dermatology, dekho beta, dermatology mein what are the high yield topic list we have given? Dermatophyte fungal infection is in the top 10 topics. एक क्वेश्चन डर्मेटोफाइट्स के ऊपर नहीं आए तो पहला विल बी लेप्रेसी. नंबर 2 डर्मेटोफाइट्स. देखो डर्मेटोफाइट इन्फेक्शन के बिना पेपर नहीं आएगा. अगर आप पूरा डर्मेटोलॉजी पढ़ के ये आंसर रॉन्ग करे तो दैट इज द टाइम टू सेलिब्रेट. Actual examiner gave a wrong answer. He gave it as malassezia furfur. But epidermophyton flocosum classically will affect the skin and nails but not the hair. Doctor, this requires talent. Not even talent, this also requires luck. Why? We all know what is superficial cutaneous nerve of the arm, forearm, etc. But suddenly a question on it innervates the dermatome which is not lying immediately above the myotome that it is supplying. Unless you are very good in brachial plexus and dermatomal pattern, you can't answer this. But brachial plexus is the top high yield topic. Without that, there is no paper. Musculocutaneous nerve. Musculocutaneous nerve supplies lateral forearm, but the myotomes that it supplies doesn't correspond to its dermatomal innervation. That's the point. Around ankle joint, what is commonly injured? Standard question. Anterior talofibular ligament is the one which is injured in the ankle sprain. Grid laser photocoagulation. Another very, very common anticipated question, clinically significant macular edema. Some of you are going to be physicians, diabetologists. Ultimately, you must be sure to prevent blindness due to diabetes. Gist tumor, doctor. Recently, we discussed Maharashtra postgraduate entrance, which was conducted last week. If you missed it, go to YouTube. You can review. We have placed it on our YouTube channel, youtube.com/onlineMBBS. Gist tumor mein lobulated appearance was the question which was asked in the recent entrance. And c-kit oncogene is the one which we are anticipating, and it was asked in COMED kit. D. Quervain's thyroiditis. Once more, if you go to surgery, doctor, one question on thyroiditis definitely will be asked. Yeah, he brought the biscuits. Yeah. So D. Quervain's thyroiditis is characterized by giant cell infiltration. Classically, if you look at the histology, it's all the giant cells which will be filling in case of D. Quervain's thyroiditis. Just few minutes, we will take a break. Stay online to take a backup.